Hey, how you doing? This is Dr. Jason Torado, your West New York chiropractor, and today I'm bringing to you a headache alert. What we're talking about today is headaches in children. Did you know that 96% of the children today have experienced some type of acute pain or some type of a headache within the past month? That's a lot, 96%. So it's Headaches take about 78% of this. That's the most common type reported by most of the kids, and you may not have known if your child was experiencing some pain. Sometimes children actually show behavioral changes rather than complaining of an actual headache. And one study actually tested a parent's knowledge of headaches versus children's recollection of headaches. And the children reported headaches about 57% of the time for the previous month, right? It also, mothers and especially fathers tended to underestimate whether their child actually ever suffered a headache. It's really alarming nowadays to see how so many children have headaches every single month, and about 6% of school children actually experience chronic pain and chronic neck pain. Over the past 30 years, childhood migraines have actually been increasing. It's been on the rise. And no one really knows for sure what type of lifestyle changes are really producing these types of painful trends, but these headaches in children are actually growing rapidly. Children with frequent headaches and severe headaches, like migraine headaches, are more likely to have difficulties with things like home life, friendships, maybe even classroom learning, and even leisure activities. And a child's quality of life and the life of those around them actually becomes to be substantially affected by these headaches that the child has. You're probably not sure if maybe taking pills might be the option for your child, because he or she may be very, very young, and it might not be the right thing to do. And you're probably really concerned right now because it's the consumption of these pills over many, many years that actually started to lead to problems. So, I'd say that these things are not to be taken like vitamins, all right? Vitamins and herbs, because they're not vitamin herbs. They're drugs. And serious things like internal bleeding or maybe kidney problems or maybe liver problems can actually really occur from long-term use of taking these pain medications. It's interesting because one study actually looked at headaches in children over a 20-year time span, and they found that medication use steadily increased in these children as they became adults, and 70% were still consuming medications daily 20 years after being originally diagnosed with a headache or pain. It's interesting, if these medications if they did work, well then why are they still taking them, right? So most patients had tension-type headaches and migraines, and that was also part of the survey. So you've got to understand that spinal problems, especially neck problems, can actually, in children, can begin with something simple like maybe during the delivery process. Also, a lot of infants, while they're young, a lot of injuries can come from childhood falls from high places, specifically during the first year of life. And this can occur as, let's say, the diaper is changed in a baby. And it's these things and other tumbles and slips and falls and traumas that cause the spinal joints to actually strain, and that causes nerves to get irritated, and sometimes it even causes discs to be injured. The chiropractor's approach to this really is to look at your child, not at just the headache, but look at your child's spinal structure and to determine if there might be a spinal cause for this particular headache. From that point, adjustments are typically delivered to specifically address the specific spinal areas inside the neck or the back, and determine whether or not the spinal vertebrae might be shifted or not in the proper place. And once they're adjusted and treated by a chiropractor, it'll allow them to function more normally and hopefully get rid of the headache in the first place without having to take any drugs or surgery. If this has happened to your child and you want to get your child off of the use of pain medications, I suggest you to give me a call. I'm Dr. Torado, your West New York chiropractor, and I'll see you soon.